Here's my audience for my presentation tonight. How y'all doing tonight? My name is Sasha Green and I'm a communication student with HCC, and I'm here to inform you all on the education of drug and alcohol addiction. I know a lot of us come from a community where we have a lot of family members that are on drugs and alcohol. Am I right?
Yeah.
Oh yes, it happens in any community, okay? So I'm gonna go ahead and brief you on what we're gonna talk about today, and we're gonna talk about how does it occur, who does it hit, and ways to prevent it and recovery. First off, I wanna say that addiction is a disease. Addiction is a disease that affects your brain and your behavior. That's why it's hard for addicts to get help or, start off by recovering, because it's a disease that's affecting them, okay? So now I'll go ahead on and tell you about who does it affect. And it affects the wealthy, because the wealthy can afford what's known as rich drugs such as cocaine and prescribed drugs. That is their go-to drugs. And for the poor community, it's street drugs such as crack cocaine, ecstasy, or anything somebody can make in their kitchen. The wealthy can pay for health coverage to get these high-priced prescribed drugs such as opioids, okay? And the youngest often peer pressure in their environment is what causes them to get addicted to drugs and alcohol. According to InspireMalibu.com, the kids or school environment is one of the big environments that have them to want to bond with everyone, and they wind up, be peer pressured to take different drugs and alcohol just to, be friends with people. The old people are usually addicted to drugs and alcohol due to traumatic events. So such as a big old divorce, a loss of promotion, or anything like that can cause a traumatic event for the elderly. Next, I will go on about the common factors that lead to drug and alcohol addiction. And here goes my visual aid to kind of give you an idea of what I'm speaking on. The first one will be trauma. Trauma is a big one. It could happen from childhood, sexual abuse, a list of things, divorce, anything could set off trauma for drug and alcohol addiction. Next will be genetically. Genetically, you can get it from your parents, your grandparents, be addicted to drugs and alcohol, and you could get that risk. According to WebMD, parents that are addicted to drugs and alcohol, it's a big risk that their kids may have it, may get it or whatever. And the last will be mental issues. A lot of people suffer with depression, which is a mental issue, and that's a big thing that a lot of people should check on. With the first and lastly, I will discuss the prevention of drug and alcohol addiction and recovery. Prevention, you could create a new environment to hang around. Don't hang around where you know the drugs and the alcohol will drive you into it, so create a new environment. Next, identify the drug abuse. If you feel like you're using too much, that's identifying it, and that will help even with someone in the recovery process. Next is therapy for mental issues. If you depressed, this and that, seek help, and that'll help instead of trying to mask it with drugs and alcohol. Next is the recovery. Recovery is different for everyone, and you have to feel like you're ready or feel like you're focused to really change. So it starts with you. The recovery starts with you, okay? So now I'm going to conclude my speech, and to conclude, I would like to say that drug and alcohol addiction can hit anyone, any nationality, gender, race. It don't have no face. Also, I dealt with it firsthand with close relatives, so I know it can be hard to deal with. Many people deny it and try to downplay it like it ain't nothing, but it's real serious, and it can lead to homelessness and crimes. So I expect anybody, to deal with it in those ways. So overall, I just want to say that something simple like mental issues, trauma could lead to drug and alcohol addiction. Okay, thank you for having me. My name is Sasha, and I thank y'all for here for my presentation. Thank you.